The fountain of youth may not exist, but with the help of a man, it can. That man that we're talking about is Dr. Robert Yoho. He's back to talk more about cosmetic surgery procedures. So, Dr. Yoho, thanks for being on the show again. We appreciate it.
Thanks again, Alex.
What I have in my hand right now is what you just handed to me, and it is a
silicone breast implant. And we've had those since January. We're able to use those on initial cases or primary cases. For about a decade, there was controversy about them, and they were studied extensively. We only had them for secondary cases or redos for a decade, but now they're as of the beginning of this year, they're back in. And over half of our implants this year have been silicones because they're so much more natural.
They're very soft, but you can tell they're sturdy.
It feels just like real breast tissue. Yeah.
You can say it, Dr. Yoho. Okay.
Yeah, they're sturdy. The material in the capsule is strong. They can rupture, but the material inside is not like a liquid. It's like a big piece of cohesive stuff. So you can get it out of the area if necessary, if it ruptured. Yeah.
All right, well, let's talk about certain procedures that you perform over in your office, and we have them in order, starting with the tummy tuck. And there's something new with the tummy tuck called the no scalpel tummy tuck. That sounds very interesting. So you're not cutting anymore?
Well, on certain individuals that are appropriate candidates, we can produce an effect very much like a tummy tuck. And I don't know whether you have a picture of this, but if you want graphic pictures, you can.
Can you see the before and after?
Yes.
Yeah, there you go.
That's one view. But if you want a more graphic look, you can go on Dr.Yoho.com and look at under no scalpel tummy tuck. They're large people that look like they have a tummy tuck. Now the skin is more like a rubber band than a paper bag, so it doesn't have to be cut in many cases because it'll shrink to fit. And so with the removal of the fat, they get a very impressive result. And the tummy tuck thing it's the most hazardous operation in cosmetic surgery because the little arteries are cut that go up to the bottom of the skin there, and it has a higher complication rate than any other procedure.
And that's a normal tummy tuck?
The regular tummy tuck, with the long scar and the modification of the belly button.
And you're right, because if you do go to dryoho.com, you can see the pictures. They're pretty big, they're pretty graphic, a little too graphic for us to put on air, but we did shrink them up a little bit. But that's a huge difference right there, even what we're looking at.
Yeah, the side views are more impressive. They have some of these people have a lot of fat on top of the muscle. A tummy tuck, actually, the muscle is sometimes shortened and hernias repaired and so on. And it's a more complicated procedure. And with a significant higher complication rate and recovery.
Does someone have to be extremely overweight or have a big tummy in order to be a good candidate?
Well, if you have a very loose, baggy, I mean, this is a complicated issue, but if you have a very loose, baggy muscle wall and you have a bulgy, sometimes you're a candidate just to get your muscle wall tightened.
Got it.
And so, but the typical candidate for tummy tucks are big people.
Okay, got it. Let's talk about breast liposuction. I had never heard of that. Dr. Yoho, what is it?
Breast liposuction has been around about 4 or 5 years, but it's becoming more or less completely accepted. And it's the same as liposuction in any other area, and most women have a large proportion of fat in their breasts, particularly women over 50. And the relief of the back pain and the strap digging in and all the other problems that you get with large breasts can be done without the aggravation of all the scarring and the complicated recovery and all that. You may not get a torpedo breast, like a young breast, but the nipples go up on an average of an inch or two. The whole skin and the breast ducts, they all contract.
So this procedure, the breast liposuction, is maybe for people who have them a little saggy?
It's for people with big breasts. And if they're
big
saggy,
but that are kind of sagging.
Yes. It's for people that don't want a breast reconstruction but want a significant volume off their breasts.
So it lifts it up a little bit.
It does lift it. The average... The nipples, on average, go up an inch or two, often 2 inches.
You know, that seems to happen, too, with a lot of moms that breastfeed after they have their kids. Doesn't that kind of happen just naturally?
Well, the mommy makeovers often want an implant. And they want... See, the breasts deflate after you breastfeed, and what they like is they want a breast that is almost like the breast they had when they were breastfeeding.
Yeah.
So,
we don't ask for much,
yeah,
Dr.
that's
Yoho.
right.
We just want to look like we used to look.
That's right.
Okay.
So the breast lipo is for people with really large breasts.
Gotcha.
And, yeah.
All right, and speaking of breast, but this time we're talking about male breast, and you can actually remove some tissue within the male breast to not make them look as saggy. First of all, is this common, and why would men want to have this procedure done?
A lot of men go around with female-looking breasts, and they're very humiliated with it all their lives. The kids, when they're 16 or 18, the males have a testosterone surge, and the testosterone is converted to the female hormone estrogen, and sometimes they'll get some ductal breast tissue which needs to be removed. So we liposuction the whole area, plus we have to remove the ductal tissue somehow, and this has traditionally been done through a cut through the nipple area, and that will frequently produce a distorted nipple. So now what we do is we go off to the side and we make about a little less than a centimeter, quarter of an inch or a little bit more incision, and we have this little grabber tool that can sort of grab those little pieces of ductal tissue, and men like good-looking nipples too.
Yeah, they do. They do. We got to think of the men too.
Yeah, that's right.
All right, we only have about a minute left, but I really want to get to another procedure that you do over at your offices. It's called a Brazilian butt lift. And we don't have any pictures of this, but still, describe to me what that is, a Brazilian butt lift.
All right, well, the Brazilian butt lift, we don't do any skin cutting.
Okay.
But we transplant fat to the butt, and we liposuction the area around the butt. And particularly important are the saddlebags and the hips and the area right above the butt. And then so when you put a little fat in the butt, it produces a shaped butt that looks really good, and you can see those on my website.
That's dryoho.com. So if I go in and say, Dr. Yoho, I'd really like a butt that looks like Beyonce, can you do that for me?
I think you have to always say, you always have to preface that by saying that the ones that look the best coming in look the best going out.
Okay.
And for you, we can do anything you want, Alex, because you look so good. But for other ones, it may not be quite as easy.
Okay. Well, you know what my mom always says, everyone's beautiful. Just some people need a little more work than others.
Well, that's generous.
All right. Well, listen, that Brazilian butt lift, that's amazing. So, the candidates for that, saggy butts?
Well, generally a person who wants a bigger behind, and bigger behinds are popular now.
Yes.
And they've been brought in by the movie stars. And so they want a backside that'll match the top side, which are getting bigger too.
Okay.
So.
All right. Well, as you mentioned before, you can see all the pictures and read more about the procedures on dryoho.com. And Dr. Yoho, not only are you such a popular doctor over in Pasadena, performing a lot of surgeries for the celebrities. I'm going to ask you about that one of these days. But you're also in Visalia. We're lucky enough, fortunate enough to have you here in Visalia in the Central Valley. Your offices are located at 805 West Asequia. Is that how you say that?
Asequia. Yeah.
Asequia. Suite 1A. Or you can just give them a call at 622-0888. You have a great staff over there, by the way. They're so nice and friendly.
Thanks, Alex.
All right. Dr. Yoho, thanks so much for coming on. I really appreciate it. We're talking about Brazilian butts and male breasts. Oh, boy, this is a family show. I'm just joking. Stick around, everybody. Their mission is to keep the future safe from abuse. We will sit down with the Safe Network when we come back.